Okay, this is medical emergencies part 2. First one is emphysema. So what does COPD stand for? That is chronic obstruction pulmonary disease. Is emphysema a form of chronic obstruction pulmonary disease? Yes. What effects does the emphysema have on the lungs? That is destruction of the little air sacs, alveoli. What is the leading cause of emphysema? And that is smoking. What are common symptoms of patients who have it? It is trouble breathing, lack of exercise, stuff like that makes you worked up. What drugs would you like to administer a patient who's having an attack from emphysema and why? And that is albuterol to help open your lungs. I just said that one. What is the maximum amount of oxygen that you would be able to give a patient? It is 2 to 4 milliliters per liters per minute. What stimulates the reflex of breathing of COPD, and that is the little oxygen level. 4 things that you should send one of your classmates to do during an emergency, and that is the AED, the emergency kit, the oxygen tank, and the medical forms or clipboard. What position should you have your patient who has an attack of emphysema? And it is straight up and down, and that is because it opens your airways in your lungs. What type of vaccine should you have a COPD patient have? And that is emphysema and pneumonia. How often should you take pulse, blood pressure, respirations during an emergency? It's every 5 minutes. How many cigarettes should a COPD patient be allowed to smoke a day? 0, negative actually. Where should you document everything during an emergency? And that is on their chart notes and the medical emergency form. If a patient is having a medical emergency, where would you remain during the emergency? And that is by their side. What is the number 1 thing you should do to prevent an emergency? And that is good medical history. Number 2 is epileptic seizures. What happens inside the brain during an epileptic seizure? And that is the discharge of electrical currents towards the brain. What is a common type of epileptic seizures? That is a grand mal seizure. What occurs first in the grand mal seizure? And that is personality changes. What occurs the second phase? And that is, loss of consciousness, falling, dizziness, stuff like that. Happens the third phase of the grand mal seizures, and that is they regain consciousness and they're very confused. What is a petit mal seizure? That occurs where they're aware but they don't lose consciousness. They're not aware of their surroundings, but they are conscious. They don't lose consciousness. And why is the status epileptic seizure so dangerous? And that's because it lasts so long. What is the first very thing you do when a patient has a seizure? That is called code blue. 4 things you send one of your classmates is the AED, oxygen tank, emergency kit, and the medical forms. If your patient is having a grand mal seizure, what position do you place your patient? And that is laying back on the dental chair or the floor. Why is it important to know the toxic level of your local anesthetic? That is because you could do a drug overdose, and that is not good. Also, make sure you have Narcan. How often should you take pulse, blood pressure, and respirations? And that is every 5 minutes. How often should you take it? How often? Same question. Oh, I'm kidding. I did that last time too. If your patient is having a seizure that lasts more than 8 minutes, should you call 911? And yes, what are the most important things you can do to help a patient who's having a seizure? And that is clear their surroundings and make sure that you don't make them feel bad, and be very comfortable with them. Don't make them feel uncomfortable or confused. Help them come to. 3 drugs would be Dilantin, Keppra, and Topramax. Where should you document everything? And that is the medical emergency kit form and their notes. Patients having an emergency, where should you remain? The emergency situation is completely resolved. That is right next to the patient. Number 1 thing you should do to prevent an emergency is to good medical history. Okay, 3rd, diabetes mellitus. Where is insulin produced and what is its function? And that is in the pancreas, and its function is to store sugar in your body. What is glycogen? Glycogen is the It is the sugar that's in your blood that the insulin produces. What is important for glucose to be consistent to provide? Why is it so important for the glucose to be consistently provided to the cells in the brain? And that's because it's its only source of energy. What type of diabetic requires injections of insulin, type 1 or type 2? That is type 1. How do most type 2 diabetics manage their disease on a daily basis? That is a diet. What percent of diabetics are type 1 and what percent are type 2? 15 and 85. What causes gestational diabetes? That is pregnancy. And during which trimesters does it occur? It is the second and third. And that is because the placenta is blocking the hormones that are coming in to produce that for the baby and not for your body yourself. What is hypoglycemia and what are some symptoms? Hypo is too little sugar, and that is when you get like sweaty, extra saliva, you're hungry. What would you give a patient who is hypo? And that is like icing, orange juice, sugary things, candy. What is hyperglycemia and what are the symptoms and conditions? Hyper is too much, and the symptoms are opposite of hypo. So dry skin, lack of appetite, lack of saliva, and so forth. If your patient were conscious with hyperglycemia, what would you suggest to them? And that is for them to give them their own insulin, because you're not allowed to do that if they are conscious. How often should you take pulse, blood pressure, respirations? That is every 5 minutes. Patients having a diabetic emergency, if you're unsure if they're hyper or hypo, what should you do? Sugar. Patient would be treated with, which patient would be treated with an injection of glycogen, and that'd be hypo or hyper patient, and that'd be hypo because they are less sugar, too little sugar, so you would inject them with sugar. You notice that your diabetic patient has a sweet, fruity, smelling breath. What emergency would you prepare for? And that would be hyper. Where should you document everything that is in the medical emergency form and their notes? If patient has an emergency, you should remain on their. Where should you remain until the situation is resolved? That is by their side. What are some questions you should ask them? Is when's the last time they took their sugar? What was their sugar? When's the last time they ate? And stuff like that. That's it for diabetes. Last but not least, it is allergic reactions. What is an allergic reaction? And that is when your body reacts to a foreign object that they're not used to, they do not like. What type of allergic reaction occurs usually within a few minutes and may be fatal if not treated? That is number 1. Which antibodies is involved with type 1 allergic, and that is IgE. What does allergic reactions occur the first time the patient, does an allergic reaction occur the first time a patient is exposed to an antigen? No. What effects does the histamine have on the bronchioles of the lungs and blood vessels? The bronchioles are constricted and the blood vessels are dilated. What does histamine cause edema? How does histamine cause edema and difficulty breathing? And that is because the bronchioles, like I said before, are constricted, so tight and closed off, and the blood vessels are wide open, which causes fluid to leak in the tissues, and that causes the tissue to swell, causing edema. If your patient tells you their tongue is beginning to swell or itchy all over, your throat begins to close up, what type of allergic reaction do you think they're having? Type 1. What is the first drug you should administer to a patient who is having a type 1 allergic reaction? That is an EpiPen. 4 things you should send your classmates to get during an emergency is an AED, oxygen tank, emergency kit, and the emergency form. Almost done. If you have given your type 1 allergic reaction patient EpiPen and they're still having trouble breathing, what other drugs should you give them and how would you administer it? And that is Benadryl, and that's through IM, which is intramuscular injection. A type 4 allergic reaction is a result of cell-mediated immune response or humoral immune response, and is cell-mediated. How often should you take blood pressure, pulse, and respirations during an emergency? Every 5 minutes. What is the number 1 cell involved with a type 4 allergic response? And that is type T. What do cell masks cause to be released into the tissue? And that is histamines. What medication could you use to treat someone who's having a type 4 reaction? And that is Benadryl. 50 milligrams. Where should you document everything that occurs during the emergency? And that is emergency form and their notes. If your patient's having an emergency, where should you remain? The emergency situation is completely resolved, and that is right next to the patient. What is the number one thing you could do to prevent an emergency? That is take good medical history. And what is the most effective drug for treating type 1 reaction? And that is epinephrine. Thank you.